Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to share with you a real simple 10-minute exercise routine where you can do all the exercises laying down in bed or any other surface that you can lay down flat on. And these are exercises that are going to be good for either before or after knee replacement surgery. Before I jump into that, if you don't subscribe already, be sure to hit that subscribe button and turn on the notifications so you don't miss any of our latest videos related to knee replacement surgery. So let's start with laying on your back flat. Now, you can add straps or a belt or anything like that to help with the range of motion with some of these exercises. You can use towels, rolled up pillows, but let's pretend you don't have any of that equipment and you're just laying flat on your bed. So the first exercise we're going to do is a quad set. This exercise is for knee extension or straightening range of motion, and also good to start to strengthen and activate the muscles of your thigh, your quadricep muscles. So all you're going to do is you're going to try to take your knee and try to push the knee down into the bed straight. And you're going to straighten the knee, pushing the knee down. If you have good range of motion, you might even feel the heel lift up a little bit as you start to progress your range of motion. Maybe not early on, as you probably have some stiffness still. But you're just trying to push that knee down. You'll feel the quadricep muscles of your thigh tighten up and contract. That's a good thing. And you just want to do that contraction, hold it for a count of 10, and then relax. And that's usually what I'll do is you can hold it for as long as you want or do as many sets as you want. Usually what I recommend is doing 10 repetitions, holding each one for 10 seconds. Just easy to understand, easy to remember. The next thing we're going to do is heel slides. So this is going to work on your knee flexion or bending. So again, laying down in the bed, and you're just going to slide your heel up toward your head, up toward your bottom. You're going to notice your knee's going to bend at the same time. Go as far as you possibly can, and then ease off and slowly bring it back down. If you like, you can reach with the strap if you have it available. You can have it around your foot to give an extra little pull. You can use your hands if you're able to do that. Might be difficult early on after surgery. You can do just little heel slides up and down like this, or you can work on more significant ranges of motion, really trying to get the maximum amount of bend, and then easing off and relaxing off. For all these exercises, I always recommend doing both sides, even if you just have issues or surgery on the one leg, just to help, it never hurts to have good mobility on both sides and both legs. The next one we're going to do is bringing your knee to your chest or single knee to chest. So I usually start with my legs bent and my feet flat on the surface, and you're just going to bring the one leg towards your chest. If you can wrap around your thigh and pull up like this, or if it's comfortable, you can go from your shin as well. And I'll usually just go hold it for a second or two and then come back down. And usually I'll do 10 to 15 repetitions on both sides. This is a good stretch for your glute muscles, as well as just a general knee flexion, knee bending range of motion activity. We can also do straight leg raises. So again, basically doing a quad set, contracting those muscles, keeping the knee straight as possible, lifting up to about here, and then slowly bringing it back down. Again, keeping that knee perfectly straight throughout the whole exercise, keeping those quadricep muscles activated, really important to get the full benefit. Maybe doing 10 to 15 repetitions, a few sets on both sides. Next we'll do the bridging. So bridging, a good exercise for your glutes and your hip muscles. Usually what I'll recommend is you want to push your low back down into the bed before you start. That's going to do a slight tilt to your pelvis, help get the motion coming from your legs and not from arching or straining your low back. So push the low back down into the surface, keep it flat as you do the movement, lifting your hips up and then back down nice and slow. Lifting up and then down nice and slow. As you get stronger, there's going to be a variety of different progressions of the bridging exercise that you can start to incorporate to build more strength with the motion. From there, we're going to go onto our side. And we'll start with clam shells. So you want your knees and your hips bent about 45 degrees or so, stacked on top of each other. You want to keep your feet together, and you're lifting that top knee up and then back down. Usually I'll put my hand on my hip to make sure I'm in a good alignment. You don't want to lean too far forward or lean too far back, as that's a compensation to try to get more motion. And then we can also do reverse clam shells, so that's keeping the knees together and lifting the top foot up and going back down, working on internal rotation of the hip. And then lastly, we can bring that top leg out straight, and we're just going to do sideline hip abduction. Again, this one we want to avoid any compensations, so trying to keep our leg in a good alignment with our torso. We don't want it coming forward and flexing the hip, as that's a compensation to get some extra movement. You want to keep the leg back in good alignment with the hip and just going straight up and down. Again, trying to do a few sets of maybe 8 to 15 repetitions on both sides. And that's about it. So that's a really simple, probably takes you about 10 minutes to do that routine. Works on your knee bending and straightening range of motion, works on strengthening of your glutes, strengthening of your quadricep muscles, the important muscles that are going to be weak after knee replacement surgery, and is just a really simple routine, doesn't require any equipment, and you can do it laying down in your bed. If you have any other exercises that you'd like to incorporate, I'd love to hear it below in the comments. If you have any questions, please be sure to share and I'll get back to you. Thank you very much for watching.